topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon. Cold, wintry Dallas-Fort Worth. Welcome to another Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. Hey, I got to tell you, this next guest, our expert, and I hope I don't embarrass him, but I've got to share the story with you. So about 12, 15 years ago, when we started Ask the Experts at one of the Dallas radio stations, everybody I talked to said, when it comes to sleep disorders, you got to get Dr. Kent Smith. And, sometimes, listen, Dr. Kent Smith is busy. And I tried, and it was like, I want this doctor on my show so bad, and we get filled up so easy. And I kept seeing over the years people saying, how come you've got sleep disorders, which I do. I'm on a CPAP, I'm on a BiPAP machine. They said, why don't you get an expert in sleep disorders? And folks, I got to tell you, there's only one doctor in not just Dallas-Fort Worth, in the state of Texas, who specializes in this area that I've watched grow. No one greater than Dr. Kent Smith. Good afternoon, Dr. Smith.
Thank you. Good afternoon.
I didn't look, he's got a big smile on his face. I didn't want to embarrass you, but you are the best, Dr. Smith.
Well, you've embarrassed me, so that's good. That's all right.
I got him speechless.
Not the first time today, even.
Dr. Smith, I got to tell you what you've done with your practice and the people that you've treated over the years. People don't understand. They think snoring or just sleep apnea is not a big deal. It is a big deal. But first of all, tell people about your practice.
Yeah, well, the name of our practice is Star Sleep and Wellness. We just opened a 5th location. We're looking at opening a 6th one in Mansfield in a few months. We treat all sleep disorders, like you mentioned, and we treat about 4,000 patients a year. So there's a lot of people with sleep problems, and I would say 2/3 at least of the population has some kind of a sleep problem, and that's a lot. And that's going to include insomnia as well as snoring and sleep apnea and the other sleepwalking. I mean, there's lots of issues that go along with sleep, but we try to address all of those.
Well, Dr. Smith, I suffer from, well, I guess I don't suffer because I'm being treated here in Florida, but I got to tell you, people, we had a lady ask a question because Facebook and iHeart are promoting your show right now. And she wanted to know, if you snore, does that mean you have sleep apnea? That's a good question.
It's a good question, and it's just an indicator for it. It doesn't equal sleep apnea, but it's really one of the first signs. You can snore without having sleep apnea, but if you snore, and honestly, probably 2/3 of the world snores, I recently saw some statistics that show people in Canada snore more than people in the United States. I don't really understand that statistic, but, but, but yeah, I would say if you snore, and even people that don't snore can have sleep apnea. But I would suggest anybody that snores at least have a sleep study to rule out sleep apnea. That would be the first thing to do. And I hope you don't have it if you snore. The snoring could just bother your bed partner or your pet. You wouldn't believe how many pets will leave a bedroom because people snore so loud.
I had
I hear those
never
stories.
heard that before.
Oh, yeah. I hear those
Well,
stories.
I hate to sound like Debbie Downer, but I want people to get treated. And I think so many people let it go. Dr. Smith, tell people what happens if you do not take care of if you've got sleep apnea.
Yeah, I mean, the more severe your apnea is, the more bad things that can happen. And with mild apnea, if it's just very little amount, there's not a lot of good research that says too many bad things will happen. Obviously the snoring can bother a bed partner, but if you snore and you have sleep apnea and it climbs above that mild category into moderate or severe, then you're much more likely to have hypertension, which is another one of the first signs that we look at. If somebody has high blood pressure, they should have a sleep study to rule out sleep apnea. If they have diabetes, they should get a sleep study because it's one of the side effects. You can have depression. Your depression, the bar drops. So it's just much easier to get depressed. And nobody likes to be depressed. Well, I guess some people might, but I would hope not. But it's just easier to get depressed. Acid reflux is common. The top 5 side effects are related to the heart. So you're much more likely to have a heart attack, have cardiovascular disease, sudden cardiac death. Your heart has to work overtime. If you're not breathing in enough oxygen, you've got to breathe oxygen. If you don't breathe enough, your heart's got to beat faster and faster to supply more blood flow so that your organs get enough oxygen. And that's why when the heart works overtime during sleep, you're much more likely to develop arteriosclerosis and all the heart problems that you could have, because the heart is supposed to be resting during sleep, not overworking.
I got to tell you, this is strange because we just got a text from Norman in Mansfield. You're getting ready to open up a location in Mansfield. He wants to know, is there a difference between sleep disorders and sleep apnea?
Well, sleep apnea is just a part of a sleep disorder. Sleep disorder is the general term, and then sleep apnea belongs to that category of sleep disorders, as does sleepwalking, sleep talking. Insomnia is another type of sleep disorder. Sleep disorder is just a general term.
Do you notice sleep disorders have anything to do with restless legs at all, Dr. Smith?
Yeah, that's one other sleep disorder, and you're more likely to have restless legs and what we call periodic limb movement disorder. That happens during sleep. PLMD, periodic limb movement disorder, happens when you're asleep. If your legs move around and your arms, both of them can move around. That's another side, another sign that you could have sleep apnea. And again, if you have restless legs, if you have periodic limb movement during sleep, get a sleep study done.
It's amazing how things have changed. So when I got my sleep study done, I had to go overnight to a lab. And I hear now you can do it right from your house.
Oh, it is getting so much easier now. Sleep disorders, sleep centers at where you go and spend the night, where, 20 years ago, that was the gold standard. It's not even the gold standard anymore because these home study units have gotten so refined and diagnostic and detailed. They can get almost everything. Yeah, we still have a need for in-lab studies every once in a while. But insurance companies don't even want to pay for those anymore because they don't have to pay as much for the in-home studies. So they've gotten so small, they can just go on your wrist. There's all
Wow.
kinds of different options, but yeah, and that's why these wearables are becoming so popular. Uh, a lot of different companies are coming out with them, and patients are buying them off Amazon or wherever. And I'm glad. A lot of people get concerned that we're worried that a patient might not go in for a real sleep study if their wearable doesn't give them enough diagnostic data or says they don't have a problem. But I think they do foretell many issues that you can have with sleep. So I think they've come a long way. I'm not going to say bad things about wearables because they're so much better than they were 5 years ago.
God, I had to go in the hospital last year for 3 days, and they don't want you bringing your own CPAP in. They want you to use theirs. And I
Right.
got to tell you, it was so outdated. It was so cumbersome. It was this big old machine, and I didn't even recognize what it was, and it was totally, totally not comfortable. Uh,
Yeah.
let me ask you. So you started off as a dentist.
Uh-huh.
What made you decide to go into this, to specialize in this area?
It just became much more fulfilling. It was kind of, I walk in to see a patient that needs a root canal, and they do not want to see me walk in the room. So I got this complex. Nobody
Yeah.
likes me. Everybody hates me. But when I go in to see a patient that wants help with their sleep, they want to see me come into the room. So it's a whole lot easier. And I just gradually migrated. Once I realized that dentists could have a profound effect on people's sleep by making oral appliances that would hold the jaw open so that it didn't collapse and close the airway off, I thought, all right, this is it. This is what I want to do. This is my life's calling. I'm going to do this the rest of my life. And I've dedicated my life to it.
Well, what I love about what you do is a lot of dentists just go with the appliance only. You
Right.
handle everything. I mean,
Yes, we do.
you've got your whole bag of tricks there. But I wanted to ask you because I went through this as a snorer. You always deny it. Your wife or friends of yours, you fell asleep, and they go, "You snored," and the first thing you said, "No, I didn't. I don't snore." Why are people so embarrassed of that?
Well, I think in going back TV shows and comics and everything over the past 50 years have made it a humorous thing when somebody snores. And also it sort of makes somebody feel older because this disorder does get worse as you age. Everything kind of collapses more, unfortunately. We don't have as much muscle tone as we age. So you might not have snored when you're 25, but when you're 45, you start snoring. Well, there's reasons for that. And there's other reasons why aging can bring that on. But I think that's one reason people just think, I don't want to admit, especially men, they don't want to admit that they have any
Yes.
health problems. They're the last ones to go to the doctor. And they think, oh, well, another thing they think is that if I go to the doctor and get a sleep study done, I'm going to have to wear that mask. And they call it the Darth Vader mask and all kinds of stuff. But as you've mentioned, they've progressed a lot. They've improved a
Yeah, I
lot.
use
They're
a nasal.
quieter, they're smaller. There's different interfaces. Yeah, just the nose. You can do nose and
Mhm.
mouth. I mean, some people have to do both nose and mouth. But there's also oral appliances that can be effective. So you don't necessarily have to have a mask if you have a sleep study done.
You know, one of the things that I found that was so dangerous before I did get treatment, I was always tired. And that's one of the
Yeah.
things because you do not get a good night's sleep. And it got to where I would be driving a car, Dr. Smith, and I'd see myself dozing off, or I would be in class and doze off. And until I got it treated, it's very dangerous not to get it treated.
Yeah, it is, and it's primarily because you're not having restful sleep. There's a lot of interruptions, and every time you start to get into deep sleep, there's four stages of sleep. There's stage one, two, three, and REM sleep. REM is where we dream, and then stage three is the deepest level of sleep, and you need that deep sleep in order to improve your memory, to improve function, to improve your outlook on life, and to get good, restful, restorative sleep. So if you had a hard day where you were busy all day, you were frenetic with all the stuff you have to do. Everybody has their list of to-dos and they get behind and they never get everything done. And you may be working outside and getting tired that way, but there's a lot of things that can fatigue you. So that fatigue is you're supposed to restore from that, all of that activity. And you can only do that in deep sleep. Well, if you have sleep apnea, you're interrupted. As soon as you get into deep sleep, you get knocked out into lighter sleep. Deep sleep, knocked out of it. You don't stay in deep sleep for very long. And we see our more severe apneics, they don't get any deep sleep. I mean, zero. So I would bet if you had a sleep study before you had your CPAP machine, and then after, say 5 years, 10 years after you had it, just to see what your level of deep sleep is, I can promise you it will be improved.
We just got a text. This is from Al. This is Al in Allen, Texas. It's about time someone did a show on sleep apnea. Well, this is our second show, and Dr. Smith is not only live with us once a week, we replay his show on a weekly basis because it is so important. But he wants to know, do you actually stop breathing if you have sleep apnea?
You do. Yeah. And it's not that now there's two different kinds of sleep apnea. There's obstructive sleep apnea, where your tongue, your jaw, your base of the mouth, the tissues in the back of the throat, they stop you from breathing. You're trying to breathe, but you can't. Then there's something called central sleep apnea, where your brain doesn't send the signal to the respiratory center that's in the base of the brain that tells you, all right, it's time to breathe. Let's breathe. So that's only about 1% of all apneic patients. So by far, the majority have obstructive sleep apnea. And when you have an obstructive sleep apnea event, it has to last for 10 seconds to count as one event. So you have to stop breathing for 10 seconds. You're trying. And if that lasts 10 seconds, that's one event. You have to stop breathing 5 times every hour to have mild sleep apnea. If you stop breathing 15 times an hour, that's moderate. And if you think about that, if you're sleeping 8 hours a night, well, that's 120 times you're stopping breathing for at least 10 seconds. So that's moderate. And severe, if you stop breathing 30 times an hour, every 2 minutes you stop breathing, that's severe. We had a patient this week, he stops breathing 204 times an hour.
Wow.
204 times an hour. I honestly don't even know how somebody does that.
How does he do that?
I don't know. I don't know. But that kind of a patient, he has to be on a BiPAP machine and an oral appliance, both. That's combination therapy.
Here's Julie. Julie's in Plano. I am shocked. My best friend was treated by Dr. Smith, and he needed it bad. That's a good one. Dr. Smith, how do you decide how you're going to treat a patient, whether it's by appliance or CPAP or any other means?
Yeah, it really largely depends on the diagnosis and what the patient wants. We get people coming in that have very mild apnea. Now, with mild apnea, you don't need to have a CPAP machine. An oral appliance will be very effective. And with moderate apnea, an oral appliance is just as effective as a CPAP machine. When you get to severe, then the CPAP machine is more likely to control your apnea than an oral appliance. So that's one thing we look at as diagnosis. Now, we have some people coming in, they'll say, well, my brother wears a CPAP and he loves it. Well, you only have mild apnea. You don't really have to have a CPAP. That's okay. My brother loves his, so I want to wear a CPAP machine. Okay, we'll give you a CPAP machine. So those are the basic two things we look at. But then, you have to have teeth to hold an appliance in. Some people have claustrophobia. They can't even get through a sleep study in a sleep center because they want to put something on them and they can't do it. So they're going to struggle wearing a CPAP machine. So we're more likely to go with an appliance with that kind of patient.
If you look down, we also offer a chat line. Viewer said, does this only happen to people at night, or can it happen during the day while awake as well?
Well, it's interesting. Have you ever been walking around in the mall hearing somebody snore? No. Probably not. We instinctively know how. You don't think about it. You don't think, okay, don't snore, don't snore, don't snore. Hold my airway open. Hold it open. Hold it open. No, you just do it, right? It's an instinctive thing. You just don't have a sleep disorder when you're awake. That's why they call it a sleep disorder. Now, you may struggle sometimes. You may have a difficult time breathing during the day when you're awake. But if you struggle to breathe, it's just more difficult. It's difficult to swallow sometimes. There's some occlusion in the airway that is not allowing air to pass and food to pass. Then you're much more likely to have sleep apnea when you go to sleep.
We've only got a couple of minutes. God, the show goes by fast. For those of you who are watching on YouTube, we are streaming the phone number, but we're going to give you the number if you're listening on, like most people do, on iHeart. And like I said, if you missed today's show, if you have a friend who you'd like to turn on to the show, listen to it, you can go into iHeart, it's library or YouTube. Dr. Smith, tell people how they can reach your office. And if you could give us your locations too.
Sure. Yeah, let's start with locations. We're moving our Plano office to an office by Medical City. It should be open about mid-February. But we're in Dallas. We're in McKinney. We opened the McKinney office in January. That's a new location. We're open in Frisco, Denton, and Irving. So those are all the locations. Mansfield soon. And the best way to reach us probably is just the phone number, which is on your screen, 844-409-4657. If you want to investigate this a little bit more, our website is very robust. You can find all kinds of information on there. If you're just shy and you don't want to call, you'd rather email or contact us from the website, that's perfectly fine. That's stswell.com. Those are both ways, probably the best way to contact us.
We are so blessed to have you. You're back with us live again next month. Dr. Smith, thank you so much.
My pleasure.
Happy New Year.
Happy
You're
New
the
Year.
best.
Thank you.
We're going to take a quick break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.